Intrusive thoughts are a normal brain phenomena. Our brain is designed to have intrusions rather than not have them. So they are to be expected, and they are present in almost everyone. Most of the individuals, when that happens, most of the brains, when that happens, it is able to kind of dismiss them, discard them, not pay attention to it. However, in certain situations, it can become extremely difficult not to pay attention to it, especially when they are kind of about key things brain would want to focus on. For example, hunger. If we go to supermarket hungry, we might find that we are bothered by these thoughts of buying junk food, and which would be a very different experience if we go to supermarket after a meal. Because that's a very simple example of probably an intrusive phenomena. Still, those intrusive thoughts can be dismissed or controlled, or the term I like to use, suppressed. However, in OCD, there is a specific failure to suppress certain thoughts which are mostly related to danger or morality or rules. So brain wants to follow those rules which probably are super important to it, or wants to not do something illegal, something harmful, something dangerous which might lead to its death. So those thoughts are the thoughts which can fail suppression, conscious suppression by us. And that can then lead to a series of events which generate obsessions and then compulsions and other responses we see in OCD. So what is usually happening is we are paying more attention to these thoughts because our brain is forcing us to. Every time they are happening, they are leading to a fear response, which creates a situation of hypervigilance. Now, when it becomes full-fledged diagnosable condition, which we then call OCD, we do look at the number of intrusive thoughts as one of the markers of severity. How frequent are they? Are they happening every second, every minute, every hour? And how many? Are they happening in a cluster? Is it one thought that is coming and going away, etc., etc.? But we are looking at the thoughts, intrusive thoughts, which are triggering these fear responses. The brain circuits, there's a particular circuit which we call corticostriato-thalamocortical circuit. And we do know for now for 30 years that there is a part of the circuit, usually behind the eyeballs, we call it orbitofrontal cortex. That part has a specific job, is to attach how risky a certain situation is. So it attaches a value of risk to any situation. Like sitting in this room, how risky is for me to sit in this chair? Is it going to break, or is the roof going to fall on my head? I'm not going to ask these questions, but my brain will, because its job is to keep me safe. And there is a part of the brain, this orbitofrontal cortex, which specializes in this. Now, we do know that there is hyperactivation in this bit of the brain on both sides in OCD. It's a consistent finding. And we also know that when this hyperactivation happens, this risk assessment, if I may say, of the brain becomes unstable. So it's not giving the right answers, it's giving different answers than different parts of the brain would expect. Like my memory would say that this roof has never fallen on my head, it's not going to. My logic would say it's not going to happen. So these are different bits of the brain which are generating usual answer, but if this center is saying that it is risky, there is nothing I can do about it, because brain does this job independently. If it is related to threat, it is going to manifest as an intrusion into whatever I'm doing. So that's what we understand as the core problem in OCD, that it would manifest as an intrusion, become preoccupation for the brain, it would also have some sort of a meaning for the brain. We start calling it an obsession at this point. It is going to increase anxiety because it's mostly about survival or danger or threat to morality. Then it is going to generate a fear response. And that fear response, like pain, anxiety, or distress, or being in a state of perpetual fear, is extremely uncomfortable. We want to avoid it. So the brain would then come up with these compulsions or other responses to make it feel safe. It can't solve the problem, it can't resolve the problem, so the next best thing is to find relief. Intrusive thoughts can happen in any situation. As I was saying, brain is designed to have them rather than not have them, and the reason for that is that brain wants to be able to focus on multiple streams of thoughts at the same time. Now, when brain is doing that, it cannot pursue all of them as the dominant streams of thoughts. Suppose we want to read a book, we want to focus on the book rather than on the temperature in the room or the comfort level I'm feeling in the sofa or what someone else is asking me to do. All these are streams of thoughts which would be running in the background. So what brain is trying to do in that situation is to keep one stream of thought dominant and everything else dormant. This system of keeping thoughts dormant, it's not eliminating them. They are there in the background. They're very much that what do I need to do in the next hour after reading this book? It's a dormant thought in the brain, not eliminated completely. So to keep it dormant, brain has to use a particular strategy called suppression. This suppression can fail. And it can fail mainly for two reasons. First, simply put, the suppression can be weak. It could be weak because of the genetic factor or physiological factor of what's happening in the brain, how much blood sugar there is, etc., etc. Or the thought is too strong, which would breach through suppression. In OCD, we see a mixture of both. First thing a person needs to understand is having intrusive thoughts is normal. And second is what brain is trying to do is not something which is not in its best interest at that time. It's trying to protect itself. It's trying to protect itself by fear response. However, it is doing it in response to a wrong signal. It's like one of the analogy I can use is like that of a faulty fire alarm. There is no fire in the room, but the fire alarm is going off every now and then. And then the brain is just following procedure. What is the procedure? I have to evacuate. I know there is no fire. I've looked around. And I can understand there is absolutely no way there could be fire. But I have to follow the procedure. So what brain is doing is following a procedure to protect itself after that. The problem is once the fear response starts, like any other feeling, whether it's anger, guilt, shame, anxiety, like any other feeling, it is very difficult to interrupt them. Best strategy is to focus on what happens before fear response starts. How this intrusive thought about survival is getting a meaning, which is then leading to this activation of fear response. Intuitively, most of us try to fix the fire alarm, not the problem before the fire alarm. We try to reduce the anxiety, we try to reduce the discomfort, we try to, like again using this fire alarm analogy, we try to cover the fire alarm so that it does not make this uncomfortable sound. That's not the way we can solve the fire alarm problem. We have to go after the root cause, which usually is the intrusive thought. And that intrusive thought is manifesting itself over and over again because there is a particular circuit in the brain which is overactivated. We know a lot about this circuit, but the key thing to understand is that because it is overactivated, brain is making wrong risk assessments, and that is triggering this fire alarm. Can we retrain the circuit? The answer is yes. And we can do it very well by using exposure-based cognitive behavioral therapy. The response we are looking for is habituation. That's a learning response by the brain when it is put in these anxiety-provoking situations over and over again. It happens at a kind of longer time scale than we do our usual learning. Like I can read something from the book and learn it straight away. Exposure-based treatment target the learning system which learn by practice. So it takes anywhere from weeks to months for the brain to generate these kind of responses. But once that happens, the response usually is quite robust.